The dentist recoils in horror, his instruments clattering to the ground as the patient's thrashing legs kick at the table, sending equipment flying. He's screaming, screeching in agony as the things in his mouth keep pushing out. They're not teeth, they're too thin, slim, and pointed like needles, but pulsing and wriggling like living things. Another stray kick connects with the dentist, pushing him back on the wheels of his stool, which then slides out from under him and sends him down onto the floor too. He scrambles back, hiding under a nearby desk as he watches, trembling with the icy shudder of fear, eyes locked on the patient and the things crawling out of his mouth. There's dozens of them, maybe hundreds of needle-like protrusions seemingly trying to claw their way out, like the man's face is determined to tear itself into pieces through some relentless force of spite, so powerful that it's called forth these inhuman spines to do the job. One pushes at the soft tissue of the patient's cheek, rupturing through from underneath, punctuated by a rush of red and another screech of agonizing pain. In his desperation, the patient is fumbling with his open wound with one hand, staining his palm while trying to work the tiny rinsing sink next to the dental chair. The tiny jet of water does little to soothe the injury, only washes away the copper taste for a second before yet another spike splits open the man's lip. On the floor, hunched under the desk, the dentist can't move, can't do anything, save for keeping his surgical mask firmly against his face with trembling fingers. The patient lurches over, screaming louder, tears streaming down his face that's quickly becoming less and less recognizable as human below the nose. For the first time in his entire career, the dentist is scared for his life. A routine procedure, that was all it was meant to be. Some nasty pain in his jaw, the patient had said. Now, that same man looks more like a monster as the living spikes continue to poke their way out from his gums, hooking through his cheeks and lips as if trying to climb out of his face like the legs of an angry spider. Then comes the sound of bone cracking, splitting in two, followed by a hollow sob of pain from the patient. The noise makes the dentist's stomach lurch, as if he's going to be sick any second. And as the patient crawls towards him, it only gets worse. The man's face is covered in tears and sweat. Blood and drool pour from his mouth. The sounds of his jaw cracking and breaking get louder, each time making him writhe and cry at the agony. The patient crawls to the cowering dentist, the lower half of his face a mess of broken bone and spine stabbing through his skin. He makes a sound, a garbled, half-wailed noise distorted by the pain and his breaking jaw. It almost sounds like help. Then the next crunch happens, forcing the jaw open. The patient's cheeks split like wet paper, torn apart by the pointed ends of the growing spikes. He drops lifelessly to the floor, all of a sudden still and silent, where only seconds ago he was screaming in pain and fear. The dentist crawls apprehensively out from under the desk and stares in disbelief at the sickening sight of the man's body before him. They're still moving. They're still wriggling out of the bloodied, broken half of the face that the patient has left. Whatever these growths were, these spines, they're alive. A few are literally climbing out of the dead man's cheeks, like insects, crawling erratically over his glassy, open but empty eyes. The dentist hears the muffled noise of commotion from outside his office door, of police arriving at the scene, no doubt after his assistant overheard the agonized screams and called the emergency services. But part of the dentist doesn't register the sounds as real. He ignores it, too fixated on the things now climbing their way out of the dead patient on the floor. They look like toothpicks, slender and pointed at each side, but their movement is quick, definitely insect-like, but also familiar. Then one lifts off the patient's lifeless face into the air, hovering around the office, tapping against the window. Flies. They're like flies. A sudden, piercing cold shard of fear strikes the dentist. The door. He can't let anyone in because the flies might get out. Then his mind wanders to the others in the waiting room, the patient's friends, the other tourists all complaining of pain in their jaws. They were carrying more of these things. They'd contracted parasites. In the blur that follows, the dentist remembers his first port of call had been to contact the CDC, warn them there was a potentially dangerous parasitic infestation in the area. Then, the other group shows up not long after. Some secretive specialized division. They never give names, never flash badges, or even say who they represent, but they talk like experts. And within hours, not even days, they've made it all disappear. None of the tourists meet the same fate as the patient who died. Nobody from the area comes into the dentist's practice with the same symptoms, or living spines protruding from their gums. But he still can't sleep. The dentist still can't get the image of the patient's face out of his head, especially in his nightmares. Weeks pass, turn into months that snowball into years. Early retirement and closing down the practice do little to make the bad dreams stop, and nothing provides answers to the lingering questions. What were those spiny parasites? Where had they come from? And who were those shady types who'd made it all go away? The dentist sits at a table alone, eating freshly cooked fish in the corner of an old restaurant he started coming to as a way to try and forget. Enjoy a new lease on life. That's what everyone told him he should do now that he didn't have to stare down plaque-riddled mouths and pull-rotting cavities anymore. Then, something pokes at his inner lip. The dentist freezes, heart twinging in his chest. The feeling instantly conjures up the familiar, frightening face of the patient. Is this how it starts? His tongue probes at the small, sharp object in his mouth. It's a tiny fish bone lodged between his bottom teeth. The dentist breathes a sigh of relief, chuckling softly to himself, feeling his quickened pulse calming back down. He wiggles the fish bone, trying to dislodge it, but it's wedged in tight. So he reaches a hand out to a small pot on the table and picks up a toothpick. Of all the anomalies kept securely contained by the SCP Foundation, few are as vile and unpleasant as SCP-611. For reasons that will quickly become apparent, the personnel at the Foundation have taken to referring to the creatures designated under SCP-611 as the Parasitic Toothpicks. This is a subspecies of Dermatobia hominis, otherwise known as the human botfly. Normal, non-anomalous botflies belong to a family of insects called Ostridae that tend to lay eggs internally within mammals. Some Ostridae larvae will grow within the flesh of their host, others will develop within their gut. Dermatobia hominis is the only species within this family known to routinely parasitize human beings, or rather, that was until the discovery of SCP-611. While other botflies are very recognizably insects, where SCP-611 differs is primarily in its use of a unique, highly specific form of camouflage to implant its eggs into human hosts. As their colloquial moniker implies, instances of SCP-611 will appear to the untrained eye to be ordinary wooden toothpicks. It is unclear at what point in their life cycle SCP-611 takes on this appearance. However, once it does, it will fly around in search of a supply of toothpicks. Upon finding some, it will land near or actually in amongst other toothpicks, at which point the SCP-611 instance will shed its wings, allowing its camouflaged appearance to become even more effective. After this has happened, the fly will enter a passive state, resting in a dormant condition for a maximum of 40 days. If the presence of an SCP-611 instance remains undetected for the duration of this amount of time, then all its life signs will cease and the fly will perish. However, should someone pick up and attempt to use what they think is a toothpick but is actually an instance of SCP-611, then the next part of the parasite's life cycle will commence. The SCP-611 species survives by laying their eggs inside the gums of unsuspecting human hosts. Someone who has come into contact with an SCP-611 instance will initially notice no signs of invasion, nor will they experience any adverse side effects, at least not until after several days. Anywhere between 4 days and a full week after contact, the SCP-611 eggs that have been deposited into a person's mouth will hatch. The newly hatched larvae will then burrow into the host's jaw, causing severe discomfort to whoever has been unlucky enough to be implanted with the eggs. The pain caused by the burrowing SCP-611 larvae is sharp, intense, and continuous. Although given the oral location that they hatch in, this sensation can be wrongly attributed to toothache, a cavity, or some other form of pain caused by a dental issue. As the larvae burrow deeper into a person's jaw, they leave behind open internal wounds. These oral injuries can be prone to serious infections given the sheer number of germs in the human mouth. When experiencing the pain of newborn SCP-611 instances burrowing into the jaw, what is actually being felt by the human host is the larvae feeding. Once they have consumed a sufficient amount, the larvae will then exhibit another significant difference from other species of botfly. They enter a pupa stage, between the immature and mature points of their life cycle, similar to the pupa seen when some caterpillars mature into butterflies. However, in the case of SCP-611, the parasitic toothpick does not require a protective outer shell, a chrysalis, during its pupa stage. It is protected by the body of its human host. As a larva matures into a fully grown SCP-611 fly, its body will grow longer and its outer exoskeleton will harden. This continues until the now adult anomalous botfly's body is long and thin and sharp enough to punch through the skin of the human being it has grown inside. This is, by all accounts, excruciatingly painful for those unfortunate to be used as hosts for developing SCP-611 instances. The pointed, toothpick-like parasites will extrude from beneath the outer surface of the jaw until they have pierced the skin of the host's face, allowing the newly matured SCP-611 fly to now exit its host. Upon reaching maturity, adult SCP-611 still possess their wings, only losing them once having found a suitable supply of toothpicks to hide amongst. Once they have exited their host, the parasitic toothpicks will hover freely through the air, seeking out other members of its species to mate with. There are no discernible differences between any two instances of SCP-611, suggesting that each individual of these botflies is neither male nor female. SCP Foundation researchers have consulted experts in entomology and even those within the Foundation's own ranks who specialize in anomalous parasitology, and all evidence correlates. This is widely considered to be highly unusual for members of an insect population. Given that the SCP-611 species doesn't appear to exhibit any indicators of any biological sexes, this has led to speculation among research personnel that these parasites may not be a naturally occurring phenomenon. Further investigation proposals are still pending review and approval from the Ethics Committee and the O5 Council, with some Foundation staff seeking permission to look further into the origins of SCP-611. There has been growing concern that some person, group of interest, or other entity could be responsible for genetically engineering the parasitic toothpicks, or creating this botfly subspecies through some other anomalous means. It seems implausible that these parasites were able to adapt and evolve to perfectly imitate toothpicks, especially since humans have only used these in the previous few centuries. Many at the Foundation consider it to be highly suspect that an entire subspecies could develop in that short amount of time, unless there was some direct involvement by another party guiding the evolution of SCP-611. Further testing with SCP-611 is still required in order to determine whether their evolution occurred naturally or as the result of deliberate tampering or engineering. However, in the interim, this has done little to belay speculation among Foundation staff. The theories range wildly among different personnel. One states that SCP-611 could be the result of intentional, experimental crossbreeding between botflies performed by members of the Deer College, given their subdimensional locale and teaching of anomalous sciences. Others have posited that the parasitic toothpicks were developed by Prometheus Labs Incorporated, who have a long history of creating anomalies without the Foundation's knowledge or oversight. Regardless of who exactly created them, the mature instances of SCP-611 need to be successful in finding a partner in order for the species to survive. It only has a short time in which to achieve this, though, as the primary adult phase of their life cycle only lasts for a maximum of 72 hours in total, during which time they need to seek out another of their kind, then carry eggs to a suitable place to camouflage themselves. Anomalous entomology researchers at the Foundation have suggested that their rapid life cycle after leaving their human hosts might mean that there are a larger population of SCP-611 instances than initially thought. However, the location where their presence is thought to be more concentrated has been redacted from the SCP Foundation's files. The SCP Foundation first encountered the parasitic toothpicks at an undisclosed time post the year 2000. The exact location of the initial encounter with the anomalous botflies still remains classified, although it has been confirmed to have occurred somewhere in New Mexico. Whether this is the point of origin for SCP-611 is still widely debated, however. There are known to be other species of botflies documented in New Mexico, in particular, those that lay eggs in rabbits, but the presence of other botfly species that use human hosts for their larvae is unconfirmed. Before the Foundation arrived at the scene, a local dentist had been contacted by a group of tourists. They had only recently arrived in New Mexico, and all complained of suffering from severe tooth pain and intense stabbing sensations in their jaws. It is still unknown where these tourists had been prior to their arrival in New Mexico. However, given that they were all infected when they contacted the dentist, it stands to reason they were infected either on arrival to the state or just prior to traveling there. Discovering that each of the tourists was carrying parasite larvae, the horrified dentist quickly contacted the Centers for Disease Control. They were quick to ascertain that this infestation was far beyond even their expertise, prompting SCP agents embedded within the CDC to contact the Foundation. Stepping in to take control of the developing situation, the SCP Foundation was able to isolate the tourist group and offer them treatment. The SCP-611 larvae were removed before they could cause any permanent damage or fatal infections in the hosts. Through interviews with the tourists, Foundation agents were able to trace the outbreak of parasitic toothpicks to a local restaurant, which had been unwittingly playing host to SCP-611 instances for approximately a month. Every employee at the restaurant was rounded up and given Class A amnestics before each of their patrons also received a visit from the Foundation. Those who had also been made into hosts for SCP-611 eggs or larvae were similarly treated and then given amnestics to forget their contact with the parasites. While the vast majority of larvae were removed before they were able to fully mature and leave their hosts, some had already caused extensive damage. Multiple deaths were recorded in the area, attributed to a subsequent SCP-611 infestation that had occurred. Ever since their discovery, SCP-611 instances have been kept securely contained by the SCP Foundation. In accordance with special containment procedures, any instances of SCP-611 are to be sealed within their enclosure at all times. In order to keep the parasites alive, the specimens are provided a single piece of rotting meat per week, as per their dietary requirements. Based on the findings of Foundation researchers, the parasitic toothpicks get the most sufficient nutrition from beef tongue that has been aged at room temperature for around 2 weeks. The enclosure is overseen and maintained by a single SCP Foundation technician that specializes in insect care. When performing any and all duties within the enclosure, technicians are required to wear a full biohazard suit at all times in order to prevent a potential SCP-611 infestation. The temperature of the enclosure is to be lowered to 10 degrees Celsius during routine maintenance, so as to lower the activity level of SCP-611 instances inside. Then, afterwards, when the technician has concluded their maintenance, their biohazard suits are to be thoroughly sterilized, and with good reason. One recorded failure to follow the SCP-611 containment procedures took place on an undisclosed date referred to as Incident 611-1. According to the Foundation Incident Report, this occurred when a technician's biohazard suit wasn't correctly sterilized following maintenance on the SCP-611 enclosure. Thanks to the lack of proper sterilization, 3 instances of SCP-611 were able to escape containment. Fortunately, 2 were found quickly afterwards, seemingly attempting to get back to the other specimens, as the 2 escaped SCP-611 instances were found tapping against the glass of the observation room that looks into the enclosure. Unfortunately, though, one of the parasitic toothpicks was able to make it to on-site Brick Room 13. There, it was able to find a supply of toothpicks to camouflage itself amongst, and was then picked up and used by an unsuspecting member of personnel shortly afterwards. This led to several eggs being implanted in the staff member's mouth, resulting in larvae burrowing into their jaw and eventually bursting out from beneath their skin. The new population of SCP-611 instances created by this infestation resulted in a redacted number of deaths and an even higher rate of severe mandible trauma. Several staff required urgent medical treatment for extreme facial fractures caused by the sudden exit of multiple matured SCP-611 flies. Those who survived their injuries would return to work at the Foundation, some still with the use of their jaws. Following Incident 611-1, the Foundation saw it prevalent to move the SCP-611 enclosure to a lower level of the facility the specimens were kept at. This placed them further away from any mess halls and break rooms, where they could potentially hide among toothpicks, ready to start another new infestation. As an additional measure to avoid any future accidental SCP-611 exposure to staff, no food products are permitted on the same level as the new location of the enclosure. Any personnel who suspect a possible containment breach, or they might have contracted any SCP-611 larvae, are to report to a Foundation-assigned dental examiner for an oral hygiene check and anti-parasitic treatment when needed. Check out the DrBob Patreon and become a junior researcher today. Now go and watch another entry from the files of DrBob, like SCP-2484, Parasitic Mayonnaise Worms.